Well, thank you so much for that, Dr. Luis, for such an engaging and inspiring and eye-opening talk about trust and mistrust. We now have a panel to kind of talk about this issue and kind of get into it. I'll introduce myself first. My name is Oz Ismail. I'm the Director of Scientific Programs at the Alzheimer's Association. And it is my pleasure to be joined by this panel, along with Dr. Thomas Luis from Xavier University of Louisiana. We're also joined by Dr. Amy Thierry, also of Xavier University of Louisiana, as well as Dr. Lakeisha Williams, also from Xavier University. Also, we're joined by Dr. Maurice Cholas of Oceana Health as well. So I'd welcome our panelists to come join the stage. So thank you all so much for joining us this morning. So I know we've heard from Dr. Luis already, but perhaps if each of the panelists could introduce yourselves and tell us a little bit about your work before we get into this discussion.
Sure. Good morning. My name is Dr. Maurice Cholas. I do clinical work at Oxford Health, but also run Cholas Medical Consulting. And in my spare time, I'm chair of the board for the National Medical Association, which is the largest and oldest legacy organization for Black physicians in the country. Part of what my role and job is as a person is I think you need to be a good community member before you are a good physician. So I think this topic of talking about how do we make sure that people are integrated in the process from top to bottom really speaks to who I am and what I am, because by the time they see me as a patient, lots of things already need to have happened.
Hi, everybody. I'm Dr. Amy Thierry. I am the Associate Dean for Graduate Programs here at Xavier and also Associate Professor in the Department of Public Health Sciences. Research-wise, I'm a population health scientist who's really interested in the role of social determinants of aging, particularly for Black older adults. Presently, my research focuses on the neighborhood context and discrimination and stress, allostatic load, and how that all comes together to affect or potentially affect the development of cognitive impairment and dementia, specifically in midlife and older Black adults across the United States.
Good morning, everyone. My name is Dr. Lakeisha Williams, a clinical associate professor here in the College of Pharmacy. I'm also serving as Director of Community Engagement and Outreach for our Center for Minority Health and Health Disparities Research Education. My research focuses on health disparities, achieving health equity, really being able to educate the community. I know Dr. Luis talked about in regards to developing trust and building partnerships. And so a lot of my focus and my role is really being able to get into the community and provide that education and really being able to develop those sustainable relationships that go beyond research and community engagement.
Thank you so much for joining us on this panel. I want to pick up by starting with something Dr. Luis said in your talk. You mentioned building trust. It's not just about people, but it's also about building it with the organizations as well. Could I ask all of the panelists to kind of speak a little bit about what that looks like in community? How do we start on a personal level and then build it out with our organizations and wider kind of groups that are doing clinical trials and research around this?
I'll start off. I think a lot of times it just really starts off with us individually. I'm a clinical pharmacist by training. Many of you may have seen me at the table outside in my scrubs, being able to have that conversation, being able to get out into the community. And that's where the trust starts. Developing those relationships, having those candid conversations, being able to have a conversation that's outside of science, and just having a personal relationship and being able to establish that at that particular setting. And then that continues to be able to build. Having those continuous conversations, being able to educate, from time and time on. Trust is hard, especially when it comes to community and really being able to develop those trusting relationships with organizations, but it takes time and it's doable. So over time, you're able to continue to develop those relationships and have and further be able to provide the research education, the information about clinical trials, the information about health management and disease state, and then even beyond the funding, being able to continue to make sure that those relationships are continued to be sustained is very, very important in regards to building trust.
You know, I really think New Orleans is a wonderful model for this. You know, when you come here, no one says, Maurice, did you get an MD, PhD from Harvard? And did you do your residency training in San Antonio and your fellowship training in Chicago? And how many years have you been in practice? They say, who your mom and them? What does that mean? That means people want to understand who you are before they figure out what you can do. And I think this is a wonderful model to understand how we're talking about how organizations can work with people to make trials work better. Organizations can be that trusted emissary that explains who's your mom and them. And they can then understand the context by which this study affects them, is relevant to them, and is not harmful to them. And so trusted advisors, warm handoff, I'm sure there's good sociology terms for this, but I think this is the New Orleans way that leads with the social first and the personal second, and the sort of operational third.
And I would add on to that is when you're trying to engage the community, don't lead with an ask first. Kind of, building off of what Dr. Williams said, trust takes time. And so we can't just show up because you got your MD or your PhD. That's not enough. They want to know, are you really invested in us as a community? Can we, believe what you're going to tell us? Are you going to lead us in the right direction? But also, are you going to continue to invest in us as a community? So it takes a lot of legwork on the front end before you even start talking to them about, I want to recruit you into my clinical trial or my research study. You just got to spend time with people and just getting to know them in an organic way. And that's really the piece sometimes that's missed. We're just ready to collect the data, but you have to spend that time and make that investment in the community on the front end. And I would also say being open to hearing from them about what do you need. Where are you basically kind of starting off from in terms of your knowledge, your expectations, how you view your own community and what you think the issues are in your community before we're just jumping in. Here's my survey, here's my registration form. That might not even be a priority for the community. But if we don't know that and we're making those assumptions, our study is doomed from the jump if we're not, engaging in the community in those conversations on the front end. We'll never get their buy-in.
So trust is multi-layered, and it's not just about the individual. It's also about the institution and the organizations that you're dealing with. So even if you are a trusted individual, but you're with an organization that is not trusted, that also diminishes your ability to be effective in community. So to build trust as a community, as an organization, an institution, everything that you do has an impact on trust. So I'm at Tulane. Tulane is the largest private employer in New Orleans. So many New Orleanians have a relationship with Tulane as an employer, right? So how those employees are treated is going to impact the way that the regard that people have for the institution and whether or not they trust us. When I was able to convince the university to move some of its banking relationships from national banks and put those accounts instead into Liberty Bank here in New Orleans, the local black-owned bank, the largest black-owned bank in the country, that builds trust that Tulane is investing in the black bank that provides mortgages and business loans in the black community. When we brought Dookie Chase onto our campus, who is now providing food services for us at the stadium, we are building employment in the community. We are providing opportunities. We're buying economic development. We're buying locally. This is all an attempt to build more trusting relationship. When we establish a policy that any applicant that gets admitted to Tulane from New Orleans will get scholarships that would equal 100% of their tuition. So basically, they would go tuition free. These are strategies to build trust with the institution, so that when someone from Tulane comes into the community, they're more likely to give that person an opportunity to at least hear them out. But then when you close the hospital downtown and leave a portion of the city without access to emergency medical services, that impacts trust also, right? So everything that we do as administrators impacts the way that the community is going to trust the institution, and all of that ultimately has implications for the health research that we do.
Now, I want to touch a little bit about, thank you for addressing kind of the issue of almost barriers to trust, right? So in the previous panel, we heard about barriers to access in terms of clinical trials, but here we're talking about what those barriers are in like building trust as well before even getting to the idea of accessing clinical trials. But could the panel reflect on ways that we can be more successful in building this trust? Now, I know lots of different groups and communities leverage their community-based faith organizations and local health fairs and so on. Could I ask you to reflect on some of those kind of successful strategies that work in communities that we can build from?
Sure. I want to take a stab at this because I think this is a real nice area we can start. I appreciate introducing the concept of organizational trust as opposed to individual trust. And I think it comes down to language. We expect communities to understand the difference between a principal investigator, a postdoc, a research assistant, a professor, an ad hoc adjunct. We expect community to understand our language and organization, but we don't understand theirs. So if I say to you, what are the naturally occurring social networks in New Orleans? What is your answer? And if you don't understand those are Mardi Gras crews, those are second line crews, those are social aid and pleasure clubs, and how they came to be, but you expect them to understand how your infrastructure and organizations works, that's not fair. Because that shows that you're talking to them rather than with them, and you don't respect how they're organized well enough to even understand what to call them. So I encourage people coming here, when you see Queen Taj's beautiful Super Bowl emblem, how did that come to be? Who is Queen Taj a part of? What tribe is that? What is she sow to? Where did that inspiration come from? What neighborhood is that foundationally attached to? Those are questions that have basic answers if you cared. And people don't necessarily know the difference between an adjunct professor and a full professor, but they know how you made them feel. If you didn't make them feel good by not knowing where they come from, you can't ask them for something.
I'd like to, any of the other panelists would want to add to that, thinking about, how we work with established community organizations and, even faith organizations to continue to build this trust.
I mean, I would say, as an academic, affiliated with a university, it would not be in my best interest to not get to know those community orgs that already exist in the neighborhoods here. So, just because I wear this academic hat and I'm a researcher doesn't mean that I know everything, that, I shouldn't take that time, to, get to know, but also building those trusts within those community orgs, identifying who those community champions are and spending, again, that time with them on the front end. In the work that I've done and even how I train my students, it is important to have that time on the front end to get to know who those gatekeepers essentially are in the community. And, as was mentioned, and showing that you actually genuinely care. I will give an example. In my social determinants of health class, my students, we did our work with Dr. Griggs and his community center in Treme. And the students, their assignment was to conduct a needs assessment. So before, again, they started with their surveys, we had class in the community center in Treme. We had people from the community coming to talk to us about the history of the community. We walked the community every day that we had class just so that people could get used to knowing us. But we were with Dr. Griggs, and as you all heard, everybody knows Doc. So he was kind of our chaperone in a way to introduce us. And there's a corner store called Miss Gloria's, been in existence for 40 plus years. And so we went in, chatted with her, and one of the students ordered some pig lips. And so but she was from here, but she had, had no sort of issue with it or whatever. But when we got back to the community center, we talked about you might have just wanted that snack. That's just what you wanted. But it meant a lot to show we're here, we're part of the community, we're buying, food from your store, but just showing we're not too uppity or too removed, or we're just these academics that are just, trying to get some information, from you so that we can get access to your community. It was really a genuine sort of thing, but something that Doc reflected on with us afterwards is those, even though the student didn't mean anything by it, she was just gonna buy, she was just hungry, right? But it made a difference. It helps to, sort of break that ice and to be like, oh, we're community members just like you. We're a part of this community just like you are. But again, it took that time on the front end to, like I said, for us, have that champion in Dr. Griggs to be able to walk us through the neighborhood and introduce us. So when the students were ready to do their data collection, Doc and I weren't even with them. They felt comfortable themselves, but also the community already knew who they were. And when they presented their final project, and the director of the city health department came with some of her staff, and she said, how did you get people to talk to you? How did you collect so much data? Me and my staff, we go out. Those people don't talk to us. And the students said, well, we just asked them, like, well, what do you need? What do you think is important? We just spent time with them for weeks before we even walked around with our clipboards to ask for data. So that was just a testament, again, of even how we're training our students here at Xavier, how to be good stewards of the community in regards to doing research.
And I'd like to add to that too, just genuinely being concerned. You mentioned a lot about that. That's the community, they want to know that you're concerned about them. They want to know that you care. And so making sure that the community has a seat at the table is very, very important. Making sure that they have a voice and they're able to provide that voice from the very beginning and not just when that study comes into play. And so we've seen that, especially when COVID-19 hit, just really being able to get out into the community and provide education. We went to the community and said, well, what are your cares? What are your concerns? What are the barriers that you're hearing? And really being able to make sure that they provided that voice from the very beginning. And that's essential when we would look at everything that we do, not only with clinical trials, not only with research, but just with education. When we're driving a lot of the education and community outreach that we do, we ask the community, we include those community members on our advisory boards, and we ask them, well, what are the concerns? Because the concerns that we may have as an institution or as healthcare providers, healthcare professionals may not be that concern that that community has. And so being able to make sure that they are included and they have that voice allows them to know that we are very genuinely concerned about them.
I'm also sort of thinking about, we have emerging scholars through the Black Men's Brain Health Program, and how can we, transfer those teachings? So how can we be better mentors and teachers of like almost passing on that trust and helping them build that trust from the beginning? Do you have any examples of how you do that with your students that we can kind of share with the audience?
I know a lot of times with our students, especially with pharmacy students, physician assistant students, or even our public health students, is really becoming educated yourself. So being able to understand implicit bias, being able to understand all of these different terms that we tend to talk about, and really being able to understand culturally where we are first, and then understanding the cultures of others. That's very, very important in regards to having that cultural sensitivity, that cultural humility, understanding cultural competence, and being able to have the experience with that. So it's one thing to have the definition or to know the definition, but really being able to experience it. It's amazing a lot of times when I see some students that are even from here, that when we go to different areas, different neighborhoods, they're like, I never even came here. And I'm like, wow, I'm amazed that you're from here. You're now in the healthcare profession student and you never even had the opportunity to come to this area. So it starts from there, us being able to break those comfort zones, us being able to make sure that in order for us to be able to reach community, in order for us to be able to better educate them, we have to make sure that we put ourselves in their shoes too. So I'm going to the community, I'm being with the community, I'm learning from the community, I'm talking with the community, I'm sharing with the community. And so those are all different things that we educate our students as well, not only just what they see in the classroom, but being able to take them outside of the classroom and experience. And those are, to me, the best learners. Being able to walk hand in hand and being able to talk with the community. And so within that, they're able to develop that trust and learn what building trust and relationships look like.
Thank you for sharing that. I also want to invite the audience, also, I know there's some audience questions, we may have to pass a microphone.
While we're waiting for that question, I want to piggyback on something phenomenal. I really admire and respect the work that the three of you all are doing with students to intentionally sort of build community. As a non-academician on the panel, I work with our local chapter, the NMA, New Orleans Medical Association. And what we did when the new first years came in is we had all the first years from LSU and Tulane meet us at the Dewdrop Inn, which is a historic structure here in our community where all kind of people on the various Chitlin Circuit performances came through New Orleans. That was one of the places they came. And we actually did a bus tour of the city and had a true cultural icon explain the history of New Orleans, the history of its neighborhoods and how it comes. And I think that being intentional of explaining to people, whose are you? Not who are you, whose are you? And where are you? Really sets the foundation for how they're then gonna think about our community as they matriculate forward in their medical education, as they matriculate forward and work with good professors like the three of you. I think there's a role for not just the formal structure of clinical trials and the professors that do them. There's a role to leverage people that are in the community that want to be good partners to you to help do some of that work. And I think that's also something that doesn't need to be missed. We have partners that we don't have to do it all ourselves. Right. There's partners that want to help us do this because it benefits them to know that the students know how to talk to them as well.
Let us piggyback on that a little bit because we also do a historical tour for our incoming class every semester. We do that, and that also stimulates business in the community. It also provides business for these local tour organizations. And this is critically important, the topic you're talking about here. And I want to say this, especially to the academics in the room, that this is precisely why I went into academic administration. I get this, I used to get this all the time when I first became an administrator from my fellow professors. Oh, you're going to the dark side, you're going to become, working with the administrators and you can't trust the administrators. Universities are so many things and have so much potential. There's such huge assets for every community that they're in. And if you think that the only thing that a university does is teach, create new knowledge and train people, then you're missing the mark with where the potential to really have an impact is. By being in a position where you can allocate resources, where you get to decide how the budget is developed and where the investments happen, you get to move the needle for the institution. I talked about Liberty Bank. I talked about Dookie Chase. These are things that you can do once you're an administrator that you can never do when you're just a professor. And you can, we're the largest employer in New Orleans. So housekeeping staff did not have access to the emails, right? If you want to get a job today, you got to have an email address, basically. So by giving everyone an email address now and letting the housekeeping staff use the computer labs, now they have an opportunity to advance their own economic prospects, right? And that's what you can do when you go into academic administration. So I want to just put that little plug out there for those of you who are on faculty and who could potentially be in a position where you get to move from speaking truth to power to become the one who actually is the power, who people speak truth to, and then you get to decide where those resources are allocated. And frankly, I trust you more than I trust a lot of other people who desire to do those jobs.
All right. Listen, we have time for 2 concise, short questions. So who would like the mic? Please stand. Tell everybody who you are.
Hi, everyone. My name is Mercy Best. I'm a brain scientist at the University of Michigan. And my question is, how do we conduct a good needs assessment?
Maybe that's targeted to me because I mentioned these assessments. I think sticking with the theme of this panel, it's about the community. So, even in terms of how I taught my students in that particular class, there's theories that we learn in public health. There's survey methodology that we learn in public health. You can create the best survey, but if the community's not going to buy into it, they're not going to give you good data, if they even will give you any data at all. So it really starts with, you have to know the community that you're trying to learn about, and being comprehensive in that. One thing also that I would make a note of is, and was kind of alluded to, like the language that we use. So we might want to use our jargon, even maybe think that we're using a word or a term that most people should know. But if that word isn't used in or applicable to like their existing context, they're not going to know, what that means. It was even, in this particular group of students, there was a group that was interested in mental health, and they, even in their initial conversations, were asking people about mental health or stress, and the community was like, well, what do you mean by that? Like, I'm not stressed out. But then you start talking to them about, maybe the financial needs that they have or their safety concerns in their neighborhoods. They are experiencing stress, but that's just not how they frame it. And so even to know what language to put in your survey or your needs assessment, you have to use the language of the community so that they're better able to give you the information, the accurate information that you're looking for. We can't just create these survey tools ourselves and think the community is going to automatically understand what we're asking them. And again, it goes back to what is important to the community to better sort of tailor even the maybe categories of social determinants or whatever it is that we're looking at in that needs assessment. We have to rely on the community as true partners in that process.
We've even had our community members review the questions and provide questions. And that just, it changed up everything. And I feel like that's very, very important to make sure that you're having those community leaders, not only the leaders and the stakeholders, but just the community members that are passionate about making sure that their community is improved. And so they are able to review those questions, they are able to give feedback, they are able to say, hey, like you mentioned, place the question this specific way or ask this particular question because these are some of the concerns that we have. So really being able to make sure that you're incorporating those community members to review your needs assessment, to provide feedback, to provide the questions that are necessary and important when going to the community.
Do I have another concise question?
Hello, everyone. My name is Brother Ryder Coley. I teach neuroeducation to BIPOC and marginalized community. I'm a retired robotic engineer. So my field comes in from, of course, robotic functions and human cognition. So my question is there anything going on with teaching neuroeducation, teaching prefrontal cortex, hippocampus, these type of things? Because these, when you talk about trust, I think we have to get into cognitive deconstruction of why not and cognitive reconstruction of why you should. So that's my question. Is neuroeducation being taught along with these neuroscience initiatives?
Well, I don't see those as different things. I think you can't talk about science if you don't have a language, again, to talk about science. But my pivot to that is again, you can be the smartest person in the room, but if you don't have a way to make sure that people are coming along with you, you're just on a fancy journey alone. Part of what I want us to do as educators and leaders is to not go on these fancy journeys alone. My colleagues have done a beautiful job of explaining how to build community and build trust. That starts with language and respect and interrelationships. So when we do these teaching things, it should not be a lecture, it should be a dialogue. When we do these recruitment things, it should not be an ask, it should be a reciprocity. When we do these building things, it should not be an empire that's created, it should be a community that's created. And I think those concepts sound like small shifts, but they represent a shift in how we're going from pushing out to receiving from and interacting with.
All right. So I'm going to close the session. I'm going to thank Oz and the rest of our panel. And I would like, first of all, give them a hand, please. Because as you can see, we've been so fortunate to be able to have some brilliant minds who really care about the community to be able to be here and share for you.